The number one complaint that I hear from practices that tried RTM with other companies is that the monitoring calls that are required each month felt robotic, right? Patients were complaining. It was like someone was just calling the patient to check a box to bill a code, right? I've heard this so many times. It's like one of the most common things as I'm talking to practices. And so I decided to do something here in this video that most RTM companies would never do. I'm gonna actually go over a real recording of one of our remote providers talking to a patient, so you can understand exactly like how we're doing monitoring differently. And I'm going to show you why the quality of these calls is the difference between RTM being a value add that the patient loves versus like an annoyance that generates complaints, right? You don't really want that. And so my name's Dr. Andrew Grecki. I'm a physical therapist. I'm the owner of MovementRX and a private practice owner, and I'm going to go ahead and give you a little behind the scenes. So before I show you how we do it exactly, I want to explain, kind of what's going on at these other companies. I've talked to many practice owners who, use competitors. There's a lot of them, like maybe MedBridge or Limber Health or PT Wired, and these are real examples of what they've told me that they don't like and that patients have said to them. So practice owner number one that I can think of is, he said the remote provider would call patients and literally just say, are you doing your exercises? Yes or no? Okay, goodbye. Right? It took them 30 seconds. The patient started complaining that it felt like it was pointless and intrusive, which I don't blame them. It kind of feels like that when you hear that message, right? Another owner was talking about how they had multiple patients, tell them that the person that was calling them seemed to be annoyed. Like they were too busy to call them and they're rushing through a checklist. And one patient said it felt like it was almost like a telemarketer conversation, not a healthcare provider, and certainly not somebody that was, that they're used to seeing in the clinic. Another practice owner gave me an example. They said the monitoring calls were so generic. The remote PTA was calling. They clearly had never looked at the patient's chart. They didn't know what the condition was that the patient had. They didn't know anything about the exercises they were doing. And it was really just embarrassing, right? And that makes sense to me too. I take pride in my providers and my relationships with the patients. So why is this happening, right? Well, most RTM companies are treating monitoring as like a compliance checkbox, right? They hire, minimally trained staff. They give them a script to read. They incentivize the speed. So like how many calls can you do an hour, right? And they don't really train them in motivational interviewing or patient engagement. And I think that is a really important thing, that patient engagement. They don't give them access to clinical context, so they don't really know what their goals are. They're just saying, look, you need to hit that 10-minute or 20-minute billing threshold efficiently as possible. And, it's not actually there to help the patient, right? And so what's the result of that? Well, I can tell you the patients feel like, it's a waste of their time. They're going to complain. I mean, you're going to get patients that are going to complain about it. The practice is going to be embarrassed. That's the thing I hear. Embarrassed is the key word. And then what's the practice going to do if they're embarrassed? They're going to stop offering it, or they're going to switch vendors. But I see a lot of people just saying, oh, it didn't work for me. And that's why I built our remote monitoring team differently, right? We hire licensed PTAs, licensed CODAs, if it's in the OT world, and they're actually rehabilitation professionals with experience. And then we train them on motivational interviewing, right? We give them full access to the patient's information, and we measure success not by how many phone calls they can make, but what's the patient engagement level, right? Not call volume. And so let me show you kind of what that looks like in real practice. All right, so we're going to talk about what the anatomy of a good, what do we want our providers to do? So I'm going to walk you through a real call, and this is actually a recorded call. So I've changed the patient name for privacy, but word for word, literally this is the transcript of what we had happen recently. So the patient's name is Mary. She's 64 years old. She just had a total knee replacement. I think she was about 4 weeks post-op, right? And so the remote provider is a PTA. Her name is Sarah, and she has 8 years of experience. Most of that time has been in the clinic working with patients directly, right? Now she's a stay-at-home mom, and she's working remotely for us. So Sarah calls, and she says, hi, this is this Mary, right? Mary says, yeah, this is Mary. And Sarah says, Mary, hi, this is Sarah. I'm a physical therapy assistant. I'm working with Superior Physical Therapy, which is my practice. And do you have 5 to 10 minutes to talk about, how your home exercises are going? And of course, Mary says, oh yeah, sure, I do. But note here, we always want to ask if they have time, right? We don't assume that they want us to call, they have time to just chat, right? This shows a level of respect when you're making that phone call, right? So Sarah says, great. I can see you're about 4 weeks out from your knee replacement surgery. So she acknowledged the diagnosis and what the person's having PT for. And she just simply asked her, how are you feeling today? How are you feeling overall? Mary comes back with, I'm doing okay. Some days are better than others, but, and then Sarah's reply is, well, that's completely normal at this stage, right? I can see you've been logging into the app and doing your exercises. That's fantastic. So there's some level of encouragement there, right? And it looks like you're doing them about 5 days a week. And how does that feel for you? That's the key question, right? No, she's looking at actual data, not just blind questions. And the remote provider is acknowledging the patient's effort, right? So this is all about encouragement, motivation. So then Mary says, well, I try to do them every day, but some days my knee's just too sore, right? So Sarah, the PTA, says, you know what? That makes total sense. That's normal. Recovery is not linear, right? You're going to have good days. You're going to have tough days, but the fact that you're doing them 5 days a week is really impressive. And a lot of people struggle to stay consistent, right? What's helping you stay motivated? Another question, right? Very important. Now, why is it important? Well, no, motivational interviewing, those techniques are all based on questions, asking the right questions. So you're asking what's working for the patient, not just what's wrong, but you want the patient to acknowledge what's working, right? So Mary comes back with, I guess I really just want to get better. And knowing that someone's checking on me helps, and I don't want to let anybody down. Right? We hear that a lot. And so now the remote PTA, Sarah, she says, well, you're definitely not letting anyone down. You're doing a great job. Can I ask, on those days when your knee is too sore, are you still doing the exercises that involve the knee? Like the ankle pumps or the quad sets, right? So now again, no, we're problem solving, right? We're not judging. That's important. Again, motivational interviewing. Mary comes back with, you know what? I didn't even think about that. I just skip everything when it hurts too bad, right? Pretty normal. We hear that a lot from patients. Again, Sarah comes back and says, you know what? That's totally understandable. But here's something that might help, right? Even on your sore days, doing the gentler exercises, can actually help the soreness by keeping blood flowing. You don't have to do the hard ones, right? If you're feeling too sore, but maybe try the ankle pumps and maybe try the quad sets, even on those tough days, right? And then again, finishing with the question, does that seem doable? Again, motivational interviewing, you're not telling, you're asking. Again, it's education plus asking permission. You're not commanding, right? You're trying to engage in a normal way with the patient, right? So Mary, the patient, comes back and says, yeah, I can do that. And of course, Sarah says, that's awesome, right? I'm going to send you a message through the app just as a reminder, of which exercises are the gentle ones and the ones you can even do on sore days, right? Does that sound good? Mary, of course, says, that would be super helpful. Thank you so much. And again, the remote PTA, Sarah, says, of course, right? Now, I want to ask, is there anything about the exercises that's confusing or that you're not sure what, maybe that you're doing it right? So again, you're opening the door with this question, right? You're opening the door for her to ask more questions, right? And so Mary comes back and says, well, the straight leg raises, I'm not sure if I'm doing them correctly, right? My knee keeps bending a little bit. Sarah says, okay, well, that's a great question. That's really common. Let me send you a message to your therapist and just let them know that you're kind of questioning and you're not sure about that, so that the next time you see them, they can check your form on your next visit. And in the meantime, it's okay if you do your knee bends kind of slightly weird, right? That's okay. But the important thing is that you're engaging your muscles. You should feel it tightening on the top of your thigh, and so they're explaining that. And then you're really asking, does that make sense? Right? And so again, no, it's problem solving with the patient. And then, you're flagging something that the patient can then talk to the therapist about the next time they go in. Right? So Mary comes back and says, yeah, I can do that. It makes sense to me. And so there we go. Right? And so you've got this situation where the remote provider is really there, is to encourage, to ask questions, to have the patient identify, what are the barriers they're having? Why aren't they engaging as much as they could be? And then again, finishing that conversation with like, you're doing a great job. You know, the people that really care about their health and that want to get better are doing these things. You obviously are showing that. And so that's what's going to make a huge difference, right? In the outcomes that the patient have, is whether or not there's this relationship that's established with somebody who's not seeing them all the time in the clinic, right? And that's a skill. That's a skill that we spend a lot of time on with our remote PTAs and CODAs, right? Is because that's the important part here, is asking questions, getting the patient to tell you what they're thinking, so you know kind of how to just get in their mind a little bit, right? That's going to be the difference between patients complaining about this, feeling like it's just an obligation, or somebody who's really appreciative and gives you feedback, maybe even reviews online that tell you how much they like it that somebody's there to check in with them, right? So let me break down real quick like what's happening there. There's personal connection, right? Sarah's using Mary's name. She's acknowledging her specific situation, her diagnosis. She's speaking like a human, not a robot, right? She's got data to inform her. So Sarah actually looked at the chart, so she knows like what's been going on, right? Most importantly, there's motivational interviewing, right? Instead of lecturing her, Sarah was asking about what was working, and she was able to build on her own motivation, right? There was problem solving, right? When Mary mentioned the soreness that's preventing exercise, Sarah was able to offer her a practical solution, right? So that's useful to the patient, right? There was clinical knowledge, right? Sarah could answer Mary's questions from the perspective of a provider because she's a licensed PTA. And there's a communication loop, right? Like Sarah flagged that the question that she had actually would be better handled by the therapist. So she was going to let the therapist know. And maybe most importantly is encouragement, right? Sarah ended this with positive reinforcement, right? The call was about, I think, 6 minutes or so, and that counted towards that 20 minutes of, or 10 minutes, I guess now is a new threshold of monitoring time. But more importantly, it helps Mary, right? It helps the patient feel supported. Mary feels like she learned something, right? Mary's now more likely to stay consistent with her home exercises. That is the difference between good RTM and bad RTM. It's not a billing checkbox, a chore, right? And so let me tell you exactly how we train our remote providers, right? Because this is what separates us from competitors, right? We train them. We only hire licensed providers who have experience with patients. They're not, they're not just new graduates that haven't ever interacted. They're not random people. They're licensed rehab professionals with experience. They understand anatomy and physiology. They understand rehab protocols and exercise progressions and, when to escalate concerns if there's red flags. That's, I think, really important to understand. We train in motivational interviewing. I've said it a few times, but this is like a specific counseling technique that's used to help people find their own motivation for behavior change. And in that, there's some key principles like ask open-ended questions, listen effectively, listen reflectively too, affirm the patient's efforts, summarize and reinforce to the patient what you're talking about, support the patient's self-efficacy, right? And our providers go through about 8 hours of motivational interview training before they even make their first call, right? We give a full clinical context so that the remote provider has to be able to see what's been happening, right? Before they even make the content, they need to know all these things. What's the diagnosis? What is their exercise program? What are the notes from the therapist? They're reading the EMR. They have access to the EMR, and they're looking at previous calls that might have been done. The engagement level from the app is showing, are they logging their pain scale? Are they chatting back and forth? Are they doing their exercises? And then we measure quality, not quantity. Other companies are got these remote providers trying to make as many calls as possible. We're really talking about, how did the call go, right? What's the patient satisfaction score? Did the patient have questions that were answered, right? Was there follow-up communication, with the treating therapist? Did you write this all down properly? Did the patient engagement improve after the call? How about that one? I'd rather have one great 10 to 15 minute call than 5 rushed 2-minute calls, right? And I think another big difference is we create a feedback loop with treating therapists. So after every call, our providers document and communicate to the treating therapist, right? What did the patient report? Were there any concerns or red flags? Are there any questions that need clinical judgment, right? Was there suggestions that maybe for exercise modification that maybe the therapist might want to think about next time they see them? This all gets sent to the treating therapist. So there's continuity of care. Imagine that, continuity of care. Another big difference is we're flexible with call timing, right? So if a patient needs 3-minute call, then the call is going to be 3 minutes. If the patient needs 15 minutes, we want to give them as much time as possible, right? We're not going to cut them short because we have 15 other more people to call. We're not watching the clock trying to hit, the 10-minute threshold or the 20-minute threshold or whatever it might be. We're focused on the patient's needs, right? That's the key. And so what's the result of that? Well, the patients aren't complaining about monitoring calls. They appreciate them. You should be able to, you can read our reviews in my private practice. They tell you that they appreciate them. The practice doesn't get embarrassed. They get compliments, right? And patient compliance then improves because the calls actually provided value. Imagine that, right? Let me share a couple more examples of how good monitoring calls can really make a huge difference, right? So I'll give you one example. Early identification of complications. I think that's a really, really important thing. A patient that's post rotator cuff repair, mentioned to the remote provider that his shoulder was getting more and more swollen and red, and our provider immediately flagged this for the treating therapist who had the patient come in that day, right? Turned out it was early signs of infection. So it was caught early. They avoided major complications. So what a huge benefit, right? Now that's not going to happen if you're robotic and you're just doing, the call to check in with them. They would have missed that, right? They would have completely missed that. So having that dialogue with the patient helped pick up on a red flag. Another example recently I heard, we were talking about preventing dropout. A patient with chronic low back pain told our provider she was thinking about stopping PT because she wasn't seeing the results, right? And our provider spent 10 minutes roughly on the phone talking through her concerns, kind of explaining that progress isn't always linear and encouraging her to discuss it with her therapist. The patient stayed in PT, and 2 weeks later, they had a breakthrough, which is awesome, right? Now, she's pain-free. But without that call, she was going to quit PT. And they're not going to say anything. They feel like that's confrontation. So that was to me, that's a huge win. Remember, 70% of patients don't complete a plan of care. So how are we going to fix that, right? This is part of that. Another cool example was, we were talking about improving exercise technique. So a patient mentioned he was having pain during one of his exercises. One of our PTAs was able to ask specific questions about his form and realized he was doing the exercise completely incorrect. She explained the correct technique, right? She's not going to change the exercise, but she's going to try to explain the technique. She sent a video for demonstration, problem solved. A non-clinical person or somebody who doesn't, isn't going to do that, right? Another example, we had some family education, right? So a patient's daughter was helping her elderly mother with exercises, but she wasn't sure, if it was the right way to do it. So our remote PTA offered to do a 3-way call with the patient and the daughter to walk through the exercises together. The daughter left as the caregiver feeling confident. The patient felt supported, and guess what? And compliance improved, right? So, this kind of flexibility and problem solving is what I think makes RTM, especially valuable, right? And so, when you look at, the reasons why the quality of monitoring calls should be your number one consideration when you're choosing an RTM vendor, if you want somebody to do the monitoring for you, is, your reputation is on the line, right? When a remote provider calls a patient, that patient sees them as an extension of your practice and you as the owner, right? If that call is robotic, if it's rude, if it's unhelpful, the patient's going to blame you, not the RTM company, right? You got to realize that. Your Google reviews, your patient retention, your referrals, all of it's going to be affected by the quality of these, remote people calling, right? Another big reason is bad monitoring skills, are going to kill the program if the patient complain about your calls, right? Your staff's going to stop offering RTM to them. They're going to stop turning them on in the app, right? They just don't want to deal with patient complaints. They're embarrassed. So that becomes kind of the attitude of the culture in the clinic. I've seen that happen a ton, and the program dies, and then you're going to lose the revenue and you're going to lose the outcomes that you were hoping for. Good monitoring improves outcomes, right? That's important. When patients are actually supported and encouraged, they're just more compliant, right? That's just human behavior, right? Better compliance equals better outcomes. And guess what? Better outcomes equals a better reputation, which equals more referrals. So it's not just about billing codes, right? It's about actually helping the patients get better. That's the key, right? It reduces your staff burden, right? When your remote provider handles patient questions and concerns during monitoring calls, like your staff doesn't have to. So that's a benefit of this, right? You have fewer phone calls to your front desk, fewer quick questions at the end of the appointments. And so your staff, they really feel like, since this person is helping us make these calls, we can focus on the things we want to do, which is in-person care, right? Another reason why doing monitoring the right way is important is it creates a competitive advantage, right? When patients tell their friends, my PT practice checks in on me every month to make sure that I'm doing, what I'm supposed to be doing at home. That's powerful word of mouth. It's marketing is what it is. And so it positions you as a practice that actually cares about outcomes, not just billing for visits and codes and revenue, right? The bottom line, I would not recommend choosing an RTM vendor based on price alone, right? You're going to get what you pay for. You've got these big corporations that have joined the game, private equity, and you got to really be careful who you're choosing. You don't want to choose based on the fanciest software. You want to choose based on who has the highest quality monitoring, because that is what is going to determine whether RTM is successful or fails in your practice, whether your staff likes it and whether your patients like it. If you want to learn more about how we train our remote providers and how that makes a difference in our monitoring approach, right? I put together a detailed guide, and that guide is going to include our monitoring call framework. I don't want to call it a script, but it's a framework. It's going to talk about how we use motivational interviewing techniques that we use in that process, how we handle a difficult patient conversation, right? How we measure quality of that call, and how the feedback loop with the treating therapist works, right? So you can simply download that for free. It's in the link here. It's called the Physical Therapist Guide to Remote Therapeutic Monitoring. I hope you enjoy it. And if you want to talk more about whether or not remote therapeutic monitoring service, where we provide that team of remote providers is a good fit for your practice, you can book a 15-minute call with me. There's no pressure, no sales pitch, just a conversation with me about your practice and what are some of your goals and whether this makes any sense for you. So I hope you enjoyed this video. I know it was a long one, but I had a lot to say today. And I'm going to try to do one of these once a week. I'm Dr. Andrew Grecki. Hope you enjoyed this video as much as I enjoyed making it. I'll see you next time.